We've been spending some time with our friend from Mercy Health, Dr. Dennis Norem, who has been kind enough to carve time out of his schedule for us each and every Monday with some of the latest information and discussion on all of these things. Dr. Norem, good morning to you.
Good morning to you guys.
How was your weekend?
It was wonderful. Got a little lake time.
Oh, nice.
Lake time.
Nice. Yeah.
You use sunscreen?
No, actually, it was kind of cold this weekend.
Oh. Okay. All right.
Sweatshirts and sunglasses and hats, so I really didn't need any sunscreen.
That's all right. Yeah,
we'll allow it.
Yeah, he's a doctor. He can do whatever he wants because he knows what's right in this. And, you and I are fine. We are sunblock appliers. It's some of the other idiots that we work with.
Yes.
Who get up on rooftops with no shirt on or spend a day out on a boat on a sunny day with nothing, thinking, well, I want to get a little color going.
A little base.
Yeah, well, you got a nice red color going for you. All right, COVID-19. Well, Illinois reports the fewest daily COVID-19 deaths since April over the weekend.
Yeah, absolutely. I was looking at those statistics, and things have really flattened for us here in Illinois and even Winnebago County, depending on who you look at. I think we've only had 2 deaths in the last week in Winnebago County. So our numbers are down, the state's numbers are down, so what we're doing appears to be working.
And what do we attribute it to? Is it a combination of all the things we've been doing, staying away from each other, put the masks on, or is it something is it environmental? Is it warmer weather gives it a problem, or is it still yet to be determined?
It's probably still yet to be determined, but I think we were fairly aggressive in Illinois about locking things down fairly early. Obviously, Chicago was a bit of a hot spot, but that seems to have slowed down. So there's certainly multiple factors there, but I think we're doing a better job here of distancing and wearing masks than some of the other states, and we're a little slower to reopen. So we may not see some of the uptick that some of the other states like Texas, Florida, and Arizona are seeing.
672 new confirmed cases of the disease on Sunday, according to the Illinois Department of Public Health. That's the 9th straight day of fewer than 1,000 diagnosed cases in 24 hours. Last time there were fewer than 20 deaths in a day was April 2nd, when we had 16 people pass with COVID-19.
Yeah, I think that's a good sign for us. Now, as we open, we'll have to watch the next few weeks to see if we see an uptick.
Yes, and from what I saw this weekend...
And we were talking about this off the air, yep.
We might be headed for an uptick because it seemed like masks were going great here for about, a month, something like that. And then, for whatever reason, out of the nice weather, people saw, kind of things starting to reopen. I don't know if they just relaxed. Mask usage just plummeted this weekend. It's not the default thing you do now. It's still on. I'll full disclosure. Even I misbehaved this weekend. At a gas station. I just ran in to get some stuff. I wasn't thinking about the mask. Didn't have it on. Walked in there. There were probably the 10 people in there. Not a single one was on. People. I didn't even remember until I got in my car and I saw it sitting there next to my on the passenger seat. Oh crap! I forgot to do it. We're nowhere. We're not done wearing masks, correct? And from what I hear, we're not even really kind of close to being done wearing masks. Is that right?
Absolutely, we're not done. And I agree with you. I think all of us have developed a certain complacency because, we're into this and we're seeing good weather and we're starting to get outside. And when we're outside, we probably, if we're not around anybody, obviously don't need to wear a mask. We kind of forget about it. We think, oh, gee, it's not going to affect me. So I do share that concern. I was just looking, there was a good study out of Texas A&M that was released a couple of days ago that says clearly wearing a mask decreases your ability or your susceptibility to getting COVID-19. So masks continue to be extremely important, and we have to continue to emphasize that.
Doctor, here, I'm going to tell you what my mask policy is. So when I wear mine, when I decide to do that, tell me if I'm wrong. Tell me if I need to be more prudent here. So if I'm outside, outside and I'm relatively by myself, I'm not wearing a mask. If I'm walking down the street, if I am outside, and like this weekend, I did go downtown for a little bit, and while we were kind of navigating the larger crowds, I'd throw it on. But once we got away, I wouldn't do it. Every time I go inside a place, I'm putting it on, and driving, I'm not putting it on in the car. Am I doing all right? Is that a decent model for other people to follow?
I think that's a good model. It's common sense. You're outside and nobody's really around you. You don't need a mask. If you're in a crowd outside, you definitely need a mask. When you go into a building, you have to have one because it's necessary. You can't avoid close contact as people are coming in and out of the doors. I think that's good common sense. I think you're doing fine.
If we walk through a door and there's a roof over a house and it's in public, I think mask on. It just should be the default for people right now.
Absolutely.
Okay.
Absolutely, I agree.
And I noticed, Amy and I were at the grocery store on Saturday. I noticed only one person who was a shopper who was not wearing a mask.
That's the carve out too for me. The grocery stores, people. I don't know if it's just that we've gotten so used to probably because that was the only thing we were doing for a while. The only building we were going into, so we were just so used to throwing the mask on to go into the grocery store. So, my grocery store shopping over the weekend, I think I saw 100% compliance.
Yeah, I had all but one person. But the thing that got me is I noticed that several people who worked at the grocery store were doing the mask below the nose, mask around the neck, that sort of thing, a lot more frequently than I saw customers doing it.
Not as effective.
Yeah, you also touched on the point that, excuse me, that the mask has to be over your nose and your mouth to be effective. If it's below your nose, it's not doing too much. It may filter a little bit out of your mouth, but your nose is an accessible site for coronavirus. So please have your mask where it belongs.
Looking at a piece out this morning saying these places pose the greatest risk for contracting coronavirus, talking about how the states are rolling back lockdowns, cases are still rising in some parts. According to, a survey of 4 public health experts in Michigan, they rank the locations on a scale of 1 to 10, 1 being the least risky, 10 being the most risky. So these are the spots you're at the greatest risk. So we'll start with the greatest risk. Bars and large music concerts gets a 9. Sports stadiums, gyms, amusement parks, churches, and buffets draws an 8. Public pools draws a 7. Theaters, hair salons, and barbershops pulls a 6. Planes, beaches, bowling alleys, and backyard barbecues hit a 5. Busy city sidewalks in the dental office are 4. Libraries, museums, grocery stores, hotels, and golf courses are at a 3. Pump and gas, walking, running, or biking at a 2. And restaurant, takeout, or playing tennis draws a 1. Any of those seemingly right in line, or did anything jump out at you as being wildly out of line here?
I think those are kind of in line. I'm surprised playing tennis, but I guess maybe they think there's coronavirus in the tennis ball, but I would think you'd be, more than 6 feet away, you're outside, although that may include indoor tennis, I suppose. So none of those seem to jump out at me as being out of line. I think the thing that's reassuring there is you see airline traveling is kind of down on the list. It's kind of medium. I think that was a big scare early on. People think you get on a plane and they're just circulating all those bugs. And if somebody on that plane has coronavirus, we're all going to get it. But I think the airlines are doing a decent job of decontaminating their planes after every flight. So I think that is a little bit reassuring that that's not at the top of the list.
Yeah, absolutely. That comes in, mid-list at a 5. But, I'm with Joe. I'm not using it while I'm driving alone in the car, well, although I have seen many people doing it while driving by themselves in the car.
Yeah, and I get it. If you want to do that just so you don't forget when you get out of your car, I understand that. But, just in your car by yourself, especially windows rolled up with your air conditioning on, I think we're going to be okay.
Yeah, you should be all right.
Yeah, I would agree. I think, though, as you said, it's probably, for some people, a good idea so they don't forget it, because we all do that. And I've gotten into a store and started to walk in and thought, oh, crap,
Yep.
where's my mask?
Yep. It's easy to forget it, even though there's a pile of like 16 of them in the back seat.
Yep.
So, yeah, just remember to get one over toward the front. Dr. Norem, another thing that jumped out at me I thought was a kind of interesting. Preliminary studies from an ongoing study suggest that those with a certain blood type may have some protection against the coronavirus. April, not long before it began, the genetic testing firm 23andMe began using its testing services to help scientists better understand how genetics could play a role in this. Monday of last week, the company released early results from the study, which involved more than 750,000 participants. And basically what they're saying is preliminary data shows that type O blood may be protective against the novel virus. In fact, early results indicate that people with type O blood are between 9 and 18% less likely to test positive for COVID-19 when compared to other blood types.
Yeah, very interesting. Certainly there's, many genetic factors that we've talked about previously about the ACE2 inhibitor levels, about comorbidity in terms of obesity and other illnesses that make you more susceptible, things that make you less susceptible. So it's not hard to imagine that blood type might make a difference. Now, looking at that, 9 to 18% less likely is not a huge difference. It's a fairly small number, so I think you have to put that in perspective, that's not going to allow people with O blood types to throw away their mask and say, gee, I'm or COVID-19 protected. So you have to be a little careful with that, but that is interesting, and that may help understand a way to treat the virus a little more efficiently down the road.
Speaking of being COVID-19 protected, have we made any more discoveries about if you have the coronavirus antibody in your system? Are you immune? Can you go out without risk of infection or infecting others?
I think the data is still coming in. I think everyone agrees that once you've resolved active infection, you are immune for a significant period of time, probably in the minimum of several weeks or a few months. But it remains to be seen at what point would you be susceptible to a new infection. I think we just don't have enough time under our belts to know that yet.
Yeah, and that's one of those things that we'll know, but we have to have more time to study this sort of thing. It's not something that produces an instant answer. You need that gap of space and time in order to figure this out, right?
Right, just like we see with the flu. It tends to be seasonal. We assume this is going to be seasonal. We're kind of waiting to see if the fall is indeed going to be the second wave. I think as we get into the second wave time frame, we'll know. Are people who were infected early on in February, March, April, will they be immune in the fall, or will they be susceptible to getting the disease again? I think that's remains to be seen.
The World Health Organization had a hell of a week last week. They come out, I think, on Tuesday or Wednesday saying, oh, actually, asymptomatic spread isn't really a problem.
Very rare.
Very rare. And then the next day they clarified and they said, no, we were actually talking about pre-symptomatic versus asymptomatic. There actually aren't that many asymptomatic
people. The 16% figure we gave is a 40% figure. And
they seem to be just playing a game of nomenclature there. Like, oh, when people were saying asymptomatic, they meant pre-symptomatic. It just got confused. Is that first thought that we had about asymptomatic people still being a problem hold water? It's just we should start using the word pre-symptomatic instead?
I don't know. I'm confused by that. I think it's pretty clear that asymptomatic patients excrete virus for several days during their asymptomatic period, and if they're excreting virus, they're a risk of infecting someone else. So I think this is an example of bureaucracy, how one person is not talking to the right person, and you get multiple mixed messages, and somehow the wrong message got out. And the spokesperson just ran with it without somebody really looking over what they were saying.
Which is a great thing to do in these times.
Sure. Yeah. Go unchecked and then just walk it all back the very next day after people all of a sudden stand up and go, wait, what did you just say?
This is the kind of stuff we expect from our political leaders, not from our scientists. So
Right.
it's a little discouraging.
But, as we have said before, and I think you would agree, whenever you hear someone go, well, I'm listening to the experts, I'm following the science. Well, that could mean any number of things.
Well, it could be any number of experts or pseudo-experts. So that really isn't helpful. You need to know what the source is.
Where do you... Go ahead.
I was just to say, unfortunately, you would hope the World Health Organization would have their act together and would be a good source, but everybody trips up once in a while, I guess.
Yeah. Go ahead, Joe.
No.
Yeah, because we keep hearing about this, the second wave, and we're going to see it, and then there are others who said, that's not for certain that we will see a second wave that will be of any consequence. Where do you stand on this debate?
I stand on, I think there's going to be a second wave. We don't know the extent. If we do a good job of wearing our mask, our social distancing, limiting our group meetings, be careful. We can really hopefully make that second wave minimal or of minimal consequence. But I think you have to believe that's just the way epidemics go. And there's going to be some kind of a second wave. Time will tell.
All right. Well, yeah, we are. And I plan on waiting it out and seeing. So, I've got no plans to be anywhere else because, where else can we go? Right. We're essential.
Yeah. You guys are essential. I don't know what I would do without you.
Yeah, and we feel exactly the same way. Dr. Norem, as always, we appreciate the time and the expertise. And if you're willing to join us once again next Monday while we continue to figure our way out through this crisis, we would be delighted to have you.
I will see you next week, guys.